It's an honor and privilege to be here today. The topic of this session is best MSO ideas. Thank you, Jason, Roy, the Scale team for inviting us to lead this panel. My name is Ira Kornbluth. I'm the president of Clearway Pain Solutions. I started my career as an interventional pain doc, built up a practice with multiple sites, transacted with private equity in 2017, had a recap event in 2019, and I've continued to stay with the business and grow the business. We are now branded as Clearway Pain Solutions, the largest pain management practice in the country. And from my perspective, the highest quality pain practice in the country. We have an all-star panel here today. Jordan Maya, the Senior VP and Head of Finance of Intercare Therapy, Kara Raymond, the CEO of First Fertility, and Jason Gunderson, the CEO and co-founder of Cardio One. I'll ask you guys each to take a moment and introduce yourselves and tell us a little bit about your business.
Happy to. As Jason mentioned, Jordan Maya. I'm with Intercare Therapy. We're an ABA or autism services provider, primarily in California. We also do some business in Colorado. I've been in the ABA space for about 7 years. My background is in finance and consulting, and particularly in the healthcare space. And we provide services in multiple settings, in school districts, in homes, and in centers. We've got 6 centers today, another one coming online in a couple of weeks, and continuing to expand across California and into other states. So excited to be here.
Kara Raymond, CEO of First Fertility. Have the pain and privilege of being a CEO in this really wild political time for the fertility industry, seeing some crazy things happen over the last couple of years, but it's definitely been character building. Been with this group for 2 years, was with a large GI group for 12 years before this. First Fertility is in the top 10 of platforms, but we're pretty solidly in the middle market, really nice size. We've expanded to 15 states over the last couple of years, seeing some very interesting trends, as I'm sure all of you are, and looking forward to talking about it today.
Thanks. Jason Gunderson. I'm the CEO here at Cardio One, recovering physician, worked as a hospitalist, ER doc, mostly in the physician management side. And then we founded Cardio One 3 years ago. So it was a pretty interesting ride. 3 years ago, we had no practices. There were 4 of us. Currently, we have 9 states, 10 practices, just 45 clinicians, and growing quickly. Cardiology has been a very rapidly growing space, kind of in the MSO world over the last few years due to some changes in the ASC environment. Our model is pretty unique. We work specifically with independent docs, so we're a non-acquisitory model. So doing more of an affiliate program and working with docs all over the country, and super excited to be here and kind of talk to you about what we're doing and some new ideas in MSOs.
All right, Kara, I'm going to go to you first.
Excellent.
In our discussions, First Fertility is having a keen focus on enhancing the patient experience. To me, that probably means better communication, better access, and quality of care. Can you speak to what First Fertility is doing to enhance the patient experience?
Sure. So I know we're talking about new ideas, and patient experience has been around for a long time. So I'll just remind everybody that eventually everything old is new again. And what we're seeing on the patient experience side now, different from, I think, what we have traditionally thought about. You know, historically, you think about culture, you think about customer service. What we're seeing and what we're really working towards at this moment in time is what I would describe as the psychology, like the new psychology of patients today. In particular, that generation, that's turning 30 and above, or just hitting that age range of 30. If you were born 1995 or later, they refer to that as the anxious generation. And what we see is patients that really struggle with decision making. Options will slow those patients down, prevent them from seeking or following through on treatment. So we've really started to think about our delivery of care in that context. How do we help patients, be more clear about the options that they have and or the choices that they need to make? The fertility journey is really complex and it's very lengthy. The average patient takes between 90 and 180 days to actually go from their first visit with a clinician to, really what is a meaningful step in their fertility journey in IVF, which is undergoing an egg retrieval. That's a very long time, especially if you're in a private equity backed organization that, is trying to balance all aspects of care and, then of course, just trying to support the business model that you need to deliver care. So we're looking at that psychological component. We're trying to clear those barriers for patients. It means coaching doctors to help doctors understand that your historical model of, well, here's your 5 choices things in your journey is not what helps these patients today. These patients want direction. They're used to being told what to do. They're used to being told what choices to make. And so you put too many options in front of them. What you find is kind of non-compliance of care. I think this applies in other industries, I'm sure. So we're trying to help doctors understand that patients don't want uncertainty. And so to the degree that you can be clear on what their best course of treatment is and why, it actually helps that patient move along in the journey. And then part two of that is looking at, where is all the friction and how can we remove that friction? For example, again, it's a complex process. Patients have to go through a lot of consents. They have to get diagnostic testing, and every single one of those steps is a barrier. So there's a lot of diagnostic testing that can be done at home today. It's a new development that continues to accelerate. You can get lab tests, even retail. You can just go online to LabCorp. Or you can order your own test if you want. You don't even necessarily need a physician's order for some of these tests. So removing friction to get that patient, again, if they don't have to go into an office, if they can do it at home, it just helps impact that timeline, that 90 to 180 days. And then obviously technological platforms that can help them with paperwork that has to get done. So again, it's like the frictionless components. Those two things, I would say, psychology, reducing friction, have been very material for us.
Great points. What can we learn from Kara's approach to the patient experience, and what is Cardio One doing to address and enhance the patient experience?
I think we often, I think we talk about a lot of these things. We often forget the patient kind of gets caught on that. So I frame a lot of what we've done in Cardio One and just what we talked about as being a patient myself. So I was listening to the first panel and hearing about the price difference that Dan was talking about. Like, I thought I kind of knew what was going on in healthcare, and then I walked into an echocardiogram for $5,200. And so I think it's one of those things. I think we need to educate patients more about the cost, but then access. And so our biggest thing, I hear about value-based care and all that's going on out there. And from a patient standpoint, is it all starts with access. And so one of the things we focus on in our practices is just simply access. You're not calling a complicated phone tree. You're not calling a big health system trying to figure out where to go. You're calling a smaller practice, and we prioritize access. So we're pretty much 2 business days for any patient, new or existing, to get an appointment with one of our docs. And that's really kind of starts with the patient experience. Kind of wander a little bit. I think we struggle out there I will try not to push too hard against health systems. But all the patients
feel
see
free.
these big health system names out
We're
there.
amongst friends here.
When you go out and it's just, people always think I have to go to, where I am, like Intermountain or I call it Evil Spirit instead of Common Spirit. But so we really focus on making that kind of more intimate relationship with the patient. You call the office, you get seen when you need to be seen. We have ancillary testing available. You're not having to drive somewhere else, and you're not getting one of those big bills. It's really kind of getting back to, you think, Kara mentioned coming back to where everything started. It's kind of going back to where everything started, where there were private practices and you knew your docs and there was a smaller group that you worked with. You were able to get your testing. But I think we need to think about access, and then we really need to think about affordability for patients. I don't think people really think about that, but as coinsurance is going up and you're starting to see more high deductible plans, those tests are huge. And, unfortunately, like cardiovascular medicine, 85% are employed now, probably the fastest consolidation of any specialty out there. There's not a lot of options. You have to really go and look. And so we'd like to see that become more available to patients. So we start thinking about patient experience, access, affordability.
So Jordan, we have spoken about the patient experience at InterCare in our discussions. The employee experience is very important and a focus of yours. Can you speak to what you're doing to enhance the employee experience, how that's leading to better retentions, better service for patients, and better outcomes and profitability for your business?
Absolutely. So, for us, our population is about 1,700 employees, 1,500 of those behavior interventionists, frontline workers, lower wage workers that have a very different experience in the workforce than a physician. And so we're really trying to meet our employees where they are. Our industry has 100% plus annual churn as just the standard. So we are rehiring our entire workforce every single year. It's a huge cost for our organization, and it's a huge cost for the health system in general. So a couple things that we're doing, we've implemented an early wage access program in our organization. So for employees that want access to their pay ahead of payroll and ahead of payday, this is not payday loans. This is an essentially free service to our organization and very low cost for our employees that they can access up to 50% of their pay, their hours worked, prior to actually hitting payroll and payday.